for contamination. These are the two possibilities where you can have a false positive test. But the chances of a false positive test being there are lower than the chances of false negative test.
Okay, so wonderfully told, I think, Dr. Ashish. Another question from nephew Yusuf from Nigeria. So he has asked what dose of remdesivir is used in COVID-19 patient if we are using it, and the rationale of using, and also he has asked the rationale behind use of zinc tablet in COVID-19 patients.
Okay, at the outset, remdesivir is available in very few select countries, and that too only as an experimental therapy. FDA has also approved it as an experimental therapy only. The dose is 200 milligram on day one. This can be given IV in very severely ill patients, and then from day 2 to day 5 to 10, you can give 100 milligram OD. So that's the dosage which is recommended. But we haven't used remdesivir because we don't have it. For that matter, we don't even have favipiravir, although there are certain indications that there might be a trial of at least favipiravir in India soon. Now, regarding zinc, the evidence linking zinc with any of the diseases is robust, is not very robust. In most of the conditions where there is influenza-like illness, the zinc supplementation reduces the duration of the illness by close to a day or so. That's in flu. But and in patients who are zinc deficient, there are some studies which have talked about an altered macrophage function, altered neutrophil chemotaxis. So these are the factors which may affect the ability of the body or body's immune response to fight with any infection. So zinc is an immunomodulator, and in patients who are zinc deficient, there is a role of zinc supplementation, but we need to remember that you may have a intolerance to zinc, and it can cause severe gastrointestinal intolerance, and you need to be very careful about the dose which you are giving. You need to stick to elemental zinc of 30 to 40 milligram maximum in a day, and if you take various formulations, will have different kind of quantities of elemental zinc. So you need to know what formulation you are going to use. If you are going to use zinc sulfate, then 220 milligram, I think 220 or 250 milligram of zinc sulfate contains around roughly 50 milligrams of elemental zinc. So you need to be very careful about the dosage of zinc supplementation if you are trying to give it to patients.
Yeah. So this means zinc is useful. The only thing is one should be careful about the dosage and need to consult the doctor for what dosage to be taken depending on the situation. So one more question which has been asked by Dr. Somba, again from Kenya, about the reinfection rate. Like what is the chance of reinfection or he is called recurrence? Is it the right word? Again, after the full recovery.
There are very many reports from China. There are from Wuhan. There are reports also from South Korea that people who have been declared cured from COVID-19 infection have been found to be clinically symptomatic, and when tested were found to be COVID positive again. The reason for that could be a mutation in the strain which is causing reinfection in these individuals. Uh, Fortunately, I'm not aware of very severe reinfections in these patients. Most of the infections have been milder infections. As it happens with influenza or with H1N1 or all the other viral illnesses, there is rapid mutations in these viruses. They adapt and they mutate, so leading to chances of reinfection with a different strain every year. So that might be a possibility. And the fact that there is a study which has recently been published from China where they found that there are two antibodies which have been found to have some protective effect, whereas even though there is a lot of hype about the plasma therapy, there is no conclusive evidence. It's still an experimental therapy. There's no conclusive evidence that the antibodies produced by coronavirus are immunological and protective. So that's where it stands as of today. So that again brings into the question of the vaccine and the vaccine efficacy, but that's an entirely different kind of topic altogether.
Okay, thank you, Dr. Ashish, for wonderfully answering those questions raised by our participants. Thank you very much.
Thank you so much.
Yeah. So now I'd like to invite Dr. Mini P. Singh. The question for Dr. Mini is about the antibodies that is developed in the body. So again, I think partially it has been answered by Dr. Ashish, that whether these antibodies are sufficient to defend against the reinfection. So I think anything we'd like to add? Otherwise, I think Dr. Ashish has answered that it's not clear from the studies that sufficient antibodies are there. So Dr. Mini?
Yeah, good evening, everyone. So actually, like sir mentioned, it's the neutralizing antibodies which decide whether the person is protective or not. So here, what the people have seen, that the people who are recovered, they do not have these neutralizing antibodies. So like sir mentioned, so the data on this is not exactly clear, and that is why the role of antibody tests is also being debatable as of now. So I think that answers what you want to ask.
And Steve Kulyu from Kenya is asking that about the Indian mobile testing van. Can you tell more about it?
Yeah, sure. So this mobile testing van, basically the aim was to do mass screening tests, especially in areas which are in the red zone or the densely populated areas where the high risk of COVID-19 is there. So this basically is more or less a collection facility and not a testing facility. So what is done is that these mobile buses, they go in the densely populated areas, and there, based on the fever, they report the fever, oxygen saturation, and some kind of X-rays are done there, and also the samples from the patients are collected there. So we have to understand that when we need to process the samples, you need to have a biosafety cabinet facilities. So since these facilities, because processing those hazardous samples is also a risk for the person who is processing, so that is why it cannot be done the testing cannot be done in a mobile van. So these samples have to be brought to the lab where using proper biosafety cabinets, these are processed. So this is only the person wears a PPE and collects the samples. So it is a collection facility and not per se a testing facility.
Yes, because the testing is taking place in the biosafety labs, so that's why it's only a collection which is being done. Right. Yeah. So Veronica Mutinda from Kenya, so she has asked about the running time for the tests. So
when we thought of any test, so when we thought of a real-time PCR, which is the gold standard for diagnosis of this SARS-CoV-2. So there are 3 steps. So first is the decontamination step, then is your RNA extraction step, and then the third is the actual PCR, where the work runs in the machine. So the decontamination step usually takes around 1 to 1.5 hours for 24 samples, and this is followed by a RNA extraction step. So now RNA extraction, again, it will depend upon whether you are using a manual system or an automated system. So that will again depend, and from anywhere it will range from 1 to 2 hours. And again, the run time in the PCR machine also depends on the various types of kits. So some kits, they give you results within 1 to 1.5 hours, where the other takes around 2 to 3 hours. So actual run time would vary from 6 to 9 hours depending upon the various processes that are used. But Gene Expert is believed to give you results within 45 minutes to 1 hour.
Okay, so the test varies basically. So normally this RT-PCR is giving your results in around 7 to 8 hours.
Right.
Okay. So from Samuel from Nigeria. So I think he's asking about the total number of tests per day in India because he was just wondering whether their country is doing enough tests. Huh?
So now India actually has established multiple labs have been established. So initially when this testing started in the country, it was limited to 200 labs. And these were testing samples, and this real-time PCR is a relatively cumbersome technique. And it's not like ELISA that you can do many samples in one row. So now what with the pooling strategy that has come in, so now labs